So again, really thank you for taking the time to join us today. It's 1 hour. We cannot solve all the problems in 1 hour, and hopefully this is not the last call, but the beginning of something else. And what we would like to do today, it's quickly give you some context and situation. All of you are watching the news, so you know what is happening. And afterward, I will ask Mariana to share where we stand in terms of the initiative we have launched, Telehealth for Peace. And afterward, we have a couple of speakers who will help us basically nurture the conversation. So we have Andriy, he's a health tech blogger and I would say he's an entrepreneur and based in Ukraine. We have Marcos, he's digital health specialist. We have Auti, she's also digital health specialist and also works a lot with startups. We have Benjamin Don, he's from Volunteers, but also he's a writer. He wrote a book 2 years ago. But again, what we want today is that it's a conversation, and hopefully by the end of this 1 hour, we'll have some ideas about how you could help, but also we will collect from you some ideas about how digital health company could help. And again, the question is how we can help now during the crisis, but you will see later that those people are refugees, and it's not for 2 weeks. They will be there for at least 2 to 3 years, if not 2 more. And they will need some support once the war is over. So if you don't mind, I will share my screen with you. And please put questions on the chat, ideas on the chat, and as we go, we can try to answer to them, because we want to leave as enough time to answer to your question, but also to bring some ideas. And please, if you don't understand my Franglish or English with a French accent, let me know. So I'll share my screen with you. Can you see my screen?
Not yet,
Yes,
Hisham.
we can.
Maybe it's mixed. Some can, some can't.
Yeah, I can.
Yeah, it's okay on my side. I think it's
very good. And you, Autino, can you see the screen?
No, but it's okay. I have the file, so don't worry.
Oh, okay. So please, if you don't see it, let me know. And afterward, it's just a couple of slides just to, to give context why we are here today. So basically, the ongoing war in Ukraine, it's a disaster. And it has caused hundreds of thousands of people, if not millions today, to leave their home and safety, and they are seeking safety abroad. And actually, what Marianne, why she launched this call on Saturday, and I joined her today to this call, is that we know that there's stretching lines of refugee in the border now, whether it's in Poland, in Romania, in Greece, in other places, but also within Ukraine. And hospitals are struggling to meet the demand. And actually, according to UN, we should estimate between 1 to 5 million of people that will seek refuge outside the Ukraine. That will be the biggest one in this century, and I think is the biggest one since the Second World War. So it's a huge humanitarian crisis. And like I mentioned, it's not only Poland and Romania today. We start seeing refugees now landing in Greece and Slovakia, in other places of the world. And those people sometimes don't speak other language than Ukrainian and Russian. And that's why I joined the call of Marianne. We need clinician psychologists, but also the health provider that can support those Ukrainian refugees, especially if they speak Ukrainian or Russian. This is the ideal world, but also we start now looking to translators that can support clinician psychologists who speaks English or other languages. And what we need from you today, it's basically help us with this call. I mean, you have your skills, your time, your digital capability. And like I said before, it's not about only solving the problem of now, the urgent things. We have to do it now, but also we need to take into account a more sustainable approach when this war will be over. And I would like to ask you, Marianne, to share where we stand today in the progress since 1 week.
Yes, tomorrow will be the first 7 days since we started. So at this moment, can you see me?
Yes, we can see you, yes, and hear you.
Okay. So since the moment we started, now we have around 220 individual clinicians, and we also have groups of clinicians join us from different hospitals around the world. So we have two big groups from United States, but our aim was really try to establish telehealth support, telehealth medical services for refugees and for people in Ukraine, which means that we wanted from the beginning to build something very reliable, sustainable, GDPR compliant, with certified medical help, which means that all clinicians who are coming, who will come to us, will be checked if they have a proper certification and they have a right to work within European Union. So at this moment, we already work inside Ukraine through the call center, which is physically in Ukraine, from the Unica insurance company partners. We are working with a hospital in Romania, which is in the border. And I'm planning and wishing that from the next week already, we'll have 3 full-scale telehealth platforms with Ukrainian and Russian interfaces. We worked this week very hard, and we are very thankful to our partners, our friends already, with providers of telehealth solutions to really optimize the products. Because it's like, you know, at one moment I have feeling that it's like a Frankenstein, because I asked them, cut this place, we should erase these buttons. It should be very, very simple, because people are very stressed. They cannot put, like, you know, the entire profile. So it should be very simple, plain language, and only very important functions. So really, I'm very grateful and thankful to people that they managed to do it just, I think, in 3 or 4 days. So I hope that from the next week, we will really start to do this. And then I am, how to say, in this situation, we cannot say demand, but from technical point of view, it's demand. I'm sure that we will have demand, because it's just a huge need for medical support and for really certified medical support. Thank you. If I can say something else, ask me about details. I think
no, I have 2 questions for you, actually, Marianne, to maybe.
Yeah.
So you said that we have now, I would say, 220 plus clinician and groups. Can you give examples of groups and also examples of telehealth platform that brought with them their own clinicians?
Yes, we are planning that our partners, and in this situation, again, it's not like we have clinicians, we have platforms, and people are working by themselves, they organize themselves, and this is what we rely on. Now we are just network which try to unite our forces to be very efficient. And I hope that, for example, what I know about Finland, they're trying to organize also the network of clinicians, preferably speaking Russian and Ukrainian languages, because they also have quite a big community. This is a very important requirement, because our patients, majority of them, I would say probably now 90%, they don't speak English, and they don't speak any local languages like Romanian, Hungarian, Polish, and others. So we should be very focused on this. But also we know that we will not be able to cover the entire demand only with Russian and Ukrainian speaking clinicians. We need translators, and we are looking for medical students who can speak both languages or 3 languages. So our partners from Finland, I hope that they will come as well with their community of clinicians. Another big community is Yeshiva University, which published today that they fully support our initiative. And I hope that the Children's Hospital from Washington also will join us as a group. These are some examples which I can give you.
Maria, nice. Please, comment, ask question either via voice or via chat. I already see a comment from Kadri Haria. Sorry, Kadri, if you want to comment your post.
Well, I just wanted to say that I'm here and very happy to contribute, and I'm just following the discussion, and I'm writing in the chat, and you can reach me via LinkedIn as well. We are giving our absolute best 24/7 also to provide psychological care in various languages beyond only one-to-one meetings, or like telehealth solutions, but also algorithm-based solutions are also important to consider at this point.
Yes, this is the thing which I didn't say, because tomorrow we have a Polish source. Yeah, it's a government-supported source for psychologists. And we worked very hard to make it also with Ukrainian and Russian interfaces. It will work full scale, and we are sending them groups of psychologists. It was a group from Israel, it was a group from Kazakhstan, it's a group from individuals who came to us. So this is already a full-scale working platform. And if you want, we also can help you with translation. If you want to have your own, let's say, platform for psychological help, and we would be absolutely happy to put you like inside this umbrella where all of us were joining our efforts. And another one.
Hi, if I may, I'm Kaya. I work with Hisham. Hi, everyone. I'm Polish, actually, and if you need any help with either Polish translation or anything, I would be, or like navigating through Polish government matters, I'm happy to support.
That would be lovely, Kaya. One of our asks, actually, we were overwhelmed with basically people proposing their help, and because just Marianne and myself, and we would definitely need more volunteers to help us make this operation a success and reach and impact as many people as possible.
Yes, definitely. I have, colleagues in Poland. My family is hosting Ukrainian families, and I'm happy to support as much as I can.
Yes, this is exactly what, when we speak with people, when we talk with people, this is what we are trying to explain. So if you want to help, try to self-organize yourself. So first of all, try to understand what you can do exactly, what is your scale, then to try to organize people around and come as a group. So recently I had a conversation with SAP, for example, and said, we have IT cool guys. We are the coolest ERP system in the world. I said, okay, make a small program with planning, because people are coming, we know the exact amount of them, they need documentation, they need the food, they need 100 different things. This is forecasting. That's why we're also working with and planning to do telemedicine, because we know that it should stay for a long time. And we are planning demand, we are planning supply. If they will not meet, and I think that they will not meet, because demand will be much higher than supply. Then we will just say, okay, we are covering a small part, and we are working hard to increase the amount of clinicians working on our platform. 3 platforms at this moment.
I agree.
Mariana, somebody in the chat has just commented, and it may be worth just vocalizing this. So Abbey Global Health, somebody is representing Abbey Global Health today. Would you mind just describing your service, because it seems to me that it's something that could be immediately deployed?
Hi, yes, it's me, it's Wodek. I know the founder of Abbey Global Health. He announced that he's opening up his service to Ukrainians for free. It just happened that he rolled out the service in Ukrainian in the last couple of months, so that before the conflict, and he can actually provide it right now. So all you need when you sign up to the service is to use this Ukrainian word, so that you don't need to pay charges. Otherwise, the service is open for use. And also he asks if there are any medical personnel who can speak English and Russian or Ukraine to contact them directly. They would be able to onboard them.
Yes, actually, there is two different problems from this point of view. I mean, two different problems which we see, two different tasks, because people inside Ukraine, they cannot use the proper platforms because they just cannot do it. That's why the most no, let me finish. Yeah, let me finish. That's why WhatsApp, Viber, and Telegram are the best solutions in Ukraine. Inside Ukraine, this is the best thing, because people cannot go log in, put their own information about themselves. They just, the time they have just to write something in Messenger. So it's absolutely, let's say, acceptable and efficient. Yeah. Another thing that, yes, also this service should be certified. We should be sure that on the other side are not some chatbots sitting, but sitting the real clinicians and certified clinicians. If it's like this, it's absolutely perfect. It's absolutely perfect.
And if I understand, Vlodek, actually to answer to your question, Mariana, the service is in Telegram and WhatsApp and Viber. That's the service.
Yes.
That's good. Vlodek,
yes, it is.
Yes, please go ahead. I wanted to ask you to go ahead. You wanted to say something, please. Vlodek, you wanted to say something?
Yeah, I'm just posting the link to their main website. Yes, and just to confirm, yes, these are all qualified medical personnel. The company is actually growing rapidly, and they have partners all around the world. They are present in 35 countries, over 1,000 medical personnel, 22 supported languages. So it's definitely a viable company, and able also to scale up, which is quite important.
Yeah.
So please spread the news about them among your Ukrainian contacts.
We will add them also to our database of potential providers with whom we can work. Thanks a lot, Vlodek. Also, what also we should explore as additional ideas of telehealth, it's the people in the refugee. Sometimes they don't have access to necessarily a computer or smartphone. We need to start looking for companies who have telehealth kiosks that maybe with the collaboration with Médecins Sans Frontières, Doctors Without Borders, or Red Cross, they can put those kiosks there. So then, even if you don't have access to a hardware like a computer or a smartphone, there's still a community kiosk where you can do your consultation with remote doctors. And if you know any provider of those type of technology, we will be very grateful also.
Mariana, I have a question that maybe is relevant for the whole audience as well. What is the means of communicating with people on the ground? I'm not necessarily talking about just Ukraine, but as people flee the borders and we are putting together different options for them to access healthcare, what is the means currently? Are there any organized communication channels with refugees in these different countries so that they know how they can access some of these solutions?
I may tell you what is our plan. Yeah, because it's like we're doing every step and then only making the step after this we can understand if it's actually successful, not successful, efficient, not efficient, but we are trying. Yeah. So our plan is the following. First of all, there are Ukrainian mass media like news. People read news all the time. Yeah. So this is one channel. Another channel is social media. So groups between where people speak between themselves, and they're very active. Yeah. Another thing that, of course, at one moment we would like to reach government authorities local to allow us to put this information physically near the borders, and in our immigration offices, in our embassies of Ukraine within European Union. So these are the ways. But for this, of course, we need to go full scale and to have a normal good service first.
And we are setting up a website now, Auchi. But what we want to secure is at least 1 or 2 platform live before we create expectation and demand. I think Anna, you wanted to ask something?
Yes, thank you for everyone for the input. I have just one question. I'm based in Berlin, and these days we have a huge flux of people coming, and I was just wondering, following the idea which was outlined here on a telekiosk. So one thing is targeting people in Ukraine and then other people coming here. So I'm thinking now if there is anyone from Berlin here with whom I can team up, but I can also try to network eventually here, that we somehow streamline this, that we also have local ambassadors, because I think it would be really hard to navigate this. I think maybe if we put more structure at the beginning, we will be faster. So I can offer myself, I can offer my network in Berlin, because it's really getting, there is an importance to also set up like a stations here, I believe. And we are organizing, but I just wanted to ask this question here.
That's a good question. And for example, a person contacted me, and she's ready to bring a group of psychologists from Berlin. And also professors, and that's example. I think it will be grassroots, and like you said, self-organized groups under one umbrella. And once it's confirmed, I can connect both of you also.
Yeah, okay. So I think that would be good, so that we can somehow also have an overview what we are doing, but that yes, we are self-organizing, but you are aware what's done, for example.
We are building a community also for that as we go.
And this is very important, because we can, of course, we are thinking about the coverage, but also we should think about each country's like a separately, because each country now has slightly different problems. The Poland is just overwhelmed. Romania is getting, let's say, hospitals was completely full yesterday, and it's getting worse and worse. Hungary, we know, like I don't think that they will have a lot of people, honestly. So, and then it will move to Germany, to Portugal, and so on. It depending also on the local communities of Ukrainians, because people can help each other. And that's why some people are taking a very long route. They will not actually stay in Poland. They will not stay in Romania. They will move forward. So that's why, yes, of course, it's absolutely a great idea if you want to lead and organize people in exact country.
Yeah. I think we have Carlos, then Kaya. You're on mute, Carlos.
Yeah. No, absolutely. Thanks, Hisham. No, really good discussion so far. I have 2 points. Well, one, first of all, and following actually your point, Mariana. So indeed, I'm from Spain. Spain is almost at the end of this route that you were mentioning. We are already seeing as well an influx of Ukrainians. And so I fully agree. And this brings us to my second point. Each country is different, right? And we want to be able to provide people fleeing of very sustainable solutions also. One, obviously, to be supported in this very early phase, via telemedicine solutions, etc. And also, I was having a second thought, which is we really also need to be able to enable all of these refugees to really navigate the healthcare systems and the social care systems of the countries of adoption, where they might stay up to months or even years, right? So what I was thinking as well is something very interesting would be to almost like recopulate or do like a little, country by country, which doesn't have to be very deep or very detailed, but a little country by country almost guide for people to understand, right? This is maybe the body I need to go to if I want to access, say, for example, psychological help in my country of adoption already because of an issue, or this is the place I should, go to for some other reason. So almost like providing this long-term navigation, almost roadmap in some of the European countries. I think this would be also something super important moving forward in the next few years.
Well, 100%.
Okay.
That this is very good idea.
Agree.
Yes, we can, because we can have like a virtual, let's say, coverage with some forces, which can help in all countries, basically around the world, not only within the Europe. But also people should understand how they can reach. And there is also a big question with virtual care, which we have right now. It's the licenses of clinicians, how they can prescribe locally and people to go to pharmacies and buy pharmaceuticals. If American, even highly, professional clinicians, they have a right to work within the European Union, even with virtual health. So it's many questions, which are huge, by the way. It's not like they are smaller and we're trying to move mountains on these questions, but it's good that we have, and at what moment we'll see how the government authorities will react on this call. But we should raise this topic, like proactively, because if we will wait for another 1 or 2 months, then it will be just, another months of thinking, discussing, and people will stay without help.
Yeah, absolutely. There are some really good points actually from Stephanie. Just I will shut up now. But Stephanie Dever says that actually companies, I was going to say insurance companies like Allianz actually do have these guides already. So repurposing actually some of the information could be really interesting. And then your point, Mariana, of actually how to enable fleeing doctors and fleeing nurses. Some of them are staying, but maybe some of them are leaving, to actually also integrate in the local healthcare system. This is also like a really interesting enabler. So yeah, really interesting points.
And what I may say about clinicians who are coming today to our platform, the big difference between the commercial telehealth and telehealth, which we built right now, is that people are highly motivated to stay. They are highly motivated to work. So these people will not disappear in 1 week. These people will stay. Yeah. And this is a huge, power which we have on our side.
Absolutely.
Thanks a lot, Marcos.
I think Kaya
yes.
Hand up. Yeah.
Yes, thank you. So I have a contact actually, and this is not related to what Marcos mentioned, but I'm this type of person who is connecting people, and I see a lot of different opportunities. So I personally know the person from Ukraine, and the guy is American. He owns a startup that's registered in Estonia, and they hire 20 people in Ukraine. So currently their focus is to startup and scale up, maybe even more on providing shelters to patients. But in general, the startup he has, I posted the link in the chat, and this is a blockchain platform for digital health networks. They have this platform for digitalizing medical records, and they have network of service providers and patients, and they're already in Ukraine. So maybe we can try to reach out through this company. I don't know the company itself, but please check and let me know. Okay.
Yeah,
okay,
thank you.
So the company they just mentioned, the company that they just mentioned now, I'm one of the ambassadors of the same company. The whole company is Global Telehealth Exchange, and part of it is called as Solve Care. So I guess we could connect. If you want, I could connect with the people who are heading the company, and they could. But the thing is, like, it depends, again, as Mariana said, the registrations, the legalities, especially the physician license. Actually, that is the basic thing, because in India we cannot do global telemedicine as such for now. As in, there is no legality obstructing it, but there is no law guiding it as far as I know for now. But inside India, we do have all the rules and regulations and possible things that we can do and we can't do on telemedicine. But yes, there are no formulated laws for the international telemedicine. But what I want to put in is, maybe we could do something like, initially the physicians who are not licensed to work there, maybe we could just talk to the patients and give them over-the-counter medicines for initial few days. If we need any referrals or anything going across, then we can refer them to the doctors who are licensed to practice in that area, so that they can get a proper prescription, and then maybe we could help out in that way. Or any doctor who is with us who can write out the prescription for us on our behalf, that would also be a great thing to do, if that is
yes,
okay.
Yeah. I think, let's say, it's a huge brainstorming process behind, because now we are like moving around all possible all possible connections, like medical students, speaking, non-speaking, Russian, Ukrainian clinicians, all possible combinations, translators, triage, without triage. So it's like, it's a normal process. Let's say this is what we repeat to ourselves. Probably the first week will be horrible. We will have a lot of mistakes, but that's okay. We are learning. We know where we are going. We will change the process if it will need it. Yeah. But I think at one moment it will be efficient enough to have a normal work. So this is our statement. Let's see.
Yeah, Hisham, there are some comments in the chat that I think it's worth vocalizing because it may just spin off other ideas and thoughts. So Andres, may I ask you to just share some information about co-nurse? And then Victoria, you mentioned about a Viber group, and Stephanie, you also mentioned about Livy. So I just think it will help to spark conversation and get more and more clarification on solutions that can help.
Yeah, so I'll start with co-nurse. Hi, everyone. So we're actually based out of Estonia as well. So we're kind of close to the problem, and many Estonians have actually went to the border to help. And we've been, with the help of the Ministry of Estonian Foreign Affairs as kind of state aid to Ukraine. We already localized co-nurse 2 years ago. What it does, it basically transforms, let's say, more kind of complex guidance into something very actionable and accessible at the point in time of care. And we're compiling a whole body of the type of guidance, first for first aid and mental health, like basic mental health issues on the ground. We do have collaborators on the ground as well in Kiev and in the western part of Ukraine. So anyone willing to provide content, we're creating new video and imagery as well to support everything. And it will be made free for distribution, mostly for civilians who are in the situation that they're in, so that they can get good evidence-based content. And it's coming from professional organizations, hospitals that we have worked with in the past, and so forth. And the info at co-nurse.net, you can just send any type of materials or collaboration requests.
I think that we will leave our emails, and for everyone who wants to step in with some solution or some idea, please send us, because we need somehow to check, to understand how it fits. Yeah. And the only one thing which I will ask from you, to be very precise. Yeah. Because I know that it's nice to send 30 pages of presentation, because I received during the day these days this long presentation, but really, like, we don't have time to read about everything. You know the exact case, you know the problem, and if you can recognize the exact function of your solution, which can be applied well to this problem, then it should be this match. Yeah?
So just so I don't know that Mariana will, I will send afterward the link of the Airtable form that we have created, because then you have all what you need in terms of what information you can provide us. Because as we go, we try to talk to each platform provider, and also where we need your help. Also, if there's someone who can help us, is to vet clinicians and psychologists, because we want to make sure that the psychologist and clinician that we want to put in front of the telehealth providers are the right ones.
And then I think a piece of information shared by Victoria is very relevant. Victoria, I don't know if you want to comment further. It's self-explanatory in the chat, but since we will be sharing this recording after, people may not have access to the chat, which is why we're trying to lift things out of the chat and make sure they get spoken as well. So Victoria, anything further to share about the Viber group in Ukraine?
I can comment on this. I can comment on this because Viber, it seems to be the most used messenger within Ukraine. So that's why majority of patients, they just prefer to have a phone number of clinicians and then to drop a message when a clinician is available to call, to have a call. And also inside Viber, as far as I understood, there are, and in Telegram, there are groups, organized groups where we can post information about the services. So I think we shouldn't worry too much how to spread this information. It will be spreaded by itself. Since services will be available. The same as I absolutely agree about people who are influencers in Ukraine. Yes, these are very like good point to send the information. Yeah, this will work for sure.
And maybe Andrei, since you are here, you can also help us. You were there actually. And from your point of view now that what is the best way to reach patients and people in need once the platforms are up and running?
Yeah, hi guys. First of all, I'm not in Ukraine right now. I'm in another country and left with my family a little bit before the war actually started. My relatives are there and my friends, a lot of my friends are there right now. And the situation is deteriorating. So just a couple of words about what's going on. It's much worse than than the Western community probably can see. So the demand, so to speak, will be much higher and much faster than many anticipate. That's the one thing, because yes, it's quite terrible what's going on right now based on what I'm getting in terms of information from friends, anyone. In terms of, I'm not a clinician, okay, I here as a marketing guy, so thank you for everyone who actually organized this super great initiative. So I don't want to spare a lot of your time because I frankly don't know. But in my opinion, I will try now to, I'm pushing out this information, our Ukraine community among doctors. I have several bloggers in medical field, Ukrainian speaking bloggers who can possibly share this link if this will be of help. Basically, that's probably the thing that I can do. Because otherwise, yeah.
Thank you, Andrei.
Sorry, I'm just not clinician. I don't.
No,
honestly,
it's absolutely fine, because even if Ukrainian clinicians, they cannot, let's say, they are not certified in European Union and they cannot work with refugees here inside European Union, but they always can help with translation, with something.
Yeah.
To help also to patients to understand. And a very important thing, if among patients we will have people who speak English and Ukrainian, they are also potential volunteers. So everybody, every patient who is coming to the platform, yeah, if he is in, let's say, more or less good condition, he is potential volunteer. And that's why we should also think about this. Yeah, we should somehow help each other. Yeah.
Yeah, we have a coordination center, a volunteer coordination center in Lviv, so they kind of helping a lot of refugees go through the border right now. So I will certainly share the platform with them and let them know. So my role here is purely to connect with the right guys in Ukraine. And that's probably what I can do best, because we indeed have lots of clinicians, lots of managers, volunteers who are helping with logistics of refugees right now. And Lviv probably is the most the hottest spot in this regard, because through Lviv basically there is the stampede right now. Everything is full, just complete mess. But anyway, that's what I can do. I don't want to share some frightening videos right now or photos, but I can if you just want to see what is really going on, because I don't know, but again, I don't want to take much of your time. Yeah.
checking, and I'm gonna really appreciate all the comments and the ideas to make the success. It's also interesting to hear from you what can be done beyond telehealth, because realistically we cannot put a doctor behind each computer and serve 5 million people. And I think that's the opportunity for the digital health companies to really show a more creative way to support those people in need in a more longer term.
And I think, I don't know, Hisham, if we have anyone from Livy on the call, but Stephanie has kindly shared the post from Johan, the CEO, who is also starting up a similar effort. Their platform is being offered, but certainly his call to action is, the kind of longer term impact of this and what can be done beyond telehealth. So Stephanie, whether you have any more information about that or anyone else on the call, but certainly it seems like Livy would be a good company to bring into the fold as well for this initiative.
Sure, I don't have much more information about their action right now, but I've worked at Livy in the past, so I could connect with the right person internally to, join effort.
Thank you, Stephanie.
Yeah, by the way, one comment. We have at the Ministry of Digital Transformation, they're quite active on the locally. So what we can do, maybe could be a great idea as well to have, a list of resources, digital resources that we can quickly plug in to.
This is exactly what I wanted to ask people who are right now in the call or probably will see the video. If you know influential people within healthcare system, because now we cannot spend the time to go the normal classical route through all of this, and wait. So please just write to us, because now today I spent a lot of time desperately trying to find connection with Ministry of Health in Ukraine, because we need to have some sort of, paperwork and stuff like this. And this is very important, and it's also kind of complicated. Thank you.
Yeah. So I will bring you in contact with the ministry as soon as I can today.
Thank you.
Thank you very much.
That's why we needed this call. Only for this, I'm super happy. Thank
exactly.
you.
And while we were talking also, it's not I'm not listening, I was checking the Abi Health, and it seems it is a good company and we should definitely connect with them. And Veronica wrote you a text. I will follow up with you on that.
Okay, thank you. One information about official channels. I'm working with EIT Health, which is really a great organization in Europe, particularly the InnoStars division in Central Europe. There's a wonderful Polish girl there who is organizing like a group for medical supplies for Ukraine. So I'm arranging the transport into Ukraine, which is quite tough because the insurance policies are invalid. But we manage that. So we have a fund which we are raising right now, and that will be managed by EIT Health. It's quite important because a lot of organizations they can't just send money anywhere. Sending money to Ukrainian accounts is incredibly difficult, and there is no confirmation that the transfer reached the right persons. Also, companies are restricted to making donations only within recognized countries. And most of all, those of you who are at all aware of how charity donations work, the major problem is the overhead costs of most of established charities. I mean, the overhead costs are just astronomical. You're talking about 80% of the money you are sending going for so-called administrative costs of that charity. and only maybe 20% will go for direct help. So with EIT Health, we are actually setting it up in a way that almost 100% will go directly for help. So it's also it's also important. So anybody who will want to, I will put you in touch with the EIT Health, who is also working with the Polish Ministry of Health to get the supplies directly through the medical ordering channels. So that's something that can be of interest to you, Mariana. My co-founders, I have a couple of co-founders in Ukraine. One of them is a medical doctor at the main military hospital in Kiev, and they have major needs for medical stuff. So that's
yes. This is exactly what we need, because we want to send this help, especially the high professionals, directly to some point. And this is the easiest and fastest way.
Yes.
And you also know, all of us, we are living in European Union, and we know how many processes we have inside. So organizations are waiting from another organization to say, yes, this is humanitarian crisis, this is a war, but one organization is waiting from another to write this statement. So yesterday, when I also talked to our partners, I told them, WHO announced, what are you asking from me? Ministry of Health from Ukraine to write you that this is a war? I mean, this is it. But I also understand that, of course, we have these processes and we should be in line. We don't want, again, we want to build sustainable system. And for this, we should meet requirements. But we'll try to do it fast. Let's see.
Excellent. I have shared on the link on the chat the link to our form. If you would like to join us and provide some of your help, or if you know a company that we should connect with, please feel free to use the link. Auti,
No, I was just going to reiterate a few points I think that have been raised through the conversation so far that I think are quite important. Mariana's request for people to self-organize, I think, is a really important point. So anything that we can do in smaller groups, get really specific before we, share a possibility, I think is just going to make the impact even quicker and greater, because there is only a certain amount that Hisham and Mariana together can cope with in terms of inbound ideas. So I think we, as individuals or small groups, need to take it beyond just a concept and an idea and a thought, and we need to actually scope it out, make sure it's practical, doable to an extent, before we share that idea and enlist their help. And then Hisham, actually, it was maybe a request for you as a follow-up that if we can get really specific as well around where we're seeing the immediate need versus the short, medium-term need. And I know those needs are all very real in these different time horizons, but, immediately where are we seeing and feeling the gaps? Mariana, for example, put a call out for influential connections in health ministries. I mean, that is an immediate thing that will unlock and unblock many things that she's trying to progress. So there may be things of that nature, of that immediacy and urgency, that I think as a follow-up will really help with the initiatives that are getting currently blocked or slowed down. And then, of course, we can continue in parallel to build the ideas and concepts to keep scaling all of this in a sustainable way. But I think it might help on our side if we, as a follow-up, really kind of get specific on our requests where we're hitting roadblocks.
Yeah, I think it's a really good question, Auti. In types of immediate need beside what you have just noted now from Marianne, we try to find a way to create a hotline and a call center support, because yes, we'll have multiple platform with clinicians, but we need a place where any person in need, whatever they are, they can reach. So a hotline and maybe a couple of people behind this line, because they will help us basically build a bridge between people in need and the platforms. We are also looking as we go to, we need people to help us vet physicians. And vet physician doesn't mean that they need to pass an exam, but just make sure they have the right license, that they, to avoid any malpractice. And also we have to build trust between those platforms and people in need. And we have to make sure that psychological clinicians that are behind the computer or the telephone are the right ones. So if any of you know a doctor or that can help, call those people who are volunteer, and that would be very, very, very also appreciated, because I'm a clinical pharmacist. I don't have the capability to do that. And Marianne, she's a digital health specialist. Another thing that we are looking at as we go, we will have more demand. And it means that we need more platforms. Talking to platform, looking what they have, the gaps, the translation. I don't know how Marianne did that, but it's a lot of work. And if there are some people who are willing to carve out a couple of hours per week and help us at least vet one platform, because it's two-way. We don't have enough time to have a backlog, and those people propose their help, and we have to be respectful to that also. An example of Lodec, you propose Abi Health, we need to reach out to them, make sure that what they have fits what we need, but also make sure that they can provide the proper onboarding to the clinicians when we find them. Those are some immediate needs from our side, Auchi. And of course, anyone who wants to join the core team, in terms of, because this is getting big and quick, and we're just in the first week now, is more than welcome. Of course, it's not full-time job. We all have our job, but if anyone wants to volunteer 2 hours per week, we will find you something where you can help and bring value to us and to people in need. Marianne, did I miss something?
No, I think it's, this is the scope which we have right now, because really we don't have resources, and that's why we started to put already priorities. So I put some health tech companies just on hold, to wait, because we want really to start with the core platforms, and then probably we'll have time to to bring more solutions.
Yeah. And Victoria, something I missed also is translators. And I think, Victoria, you mentioned that you can provide English to Russian translation. Those are very, very important people and capability that we lack. And if you know people who can do translation from Russian to English or English to Ukrainian, those will be also needed, because we have today 70% of the community of clinicians that speaks Russian, Ukrainian, but as we go, we might need the help of non-English, non-Ukrainian speaking clinicians and psychologists.
Yes, and also onboarding clinicians and onboarding patients on the platform. It's not an easy process. It's not like 2 buttons. They're simple, but not that simple. So we need to train people, to show them, to make videos and stuff like this, and make probably short instructions. And for everything, we need to have 3 languages, at least, probably even more. Probably like a bigger scope of the languages from European Union, and then it's just like huge amount.
And Hisham, I would just add to your list something you mentioned earlier, just to make sure that everyone's got the complete wish list in their mind, is you also mentioned earlier about providers of kiosks as well, and this is more a point around sustainability and scaling up for those that don't have access to anywhere where they can log in for a telehealth consultation. So we should add that also to the list.
Yes, and already some other company like Title Care proposed to give some home kit for free, because it's kiosk, but also possibility to do diagnosis remotely also. And those are little things that can make a huge impact on people in need.
Yeah. And I would just say that since we've had some people kindly already start offering their help in the chat, if I can just direct everyone to the form that Hisham has shared, the link, only because then we can build up the proper database of people offering support. And in that form, there's different choices and options around the type of support that you can offer. And that will just allow us to take a bit more of an organized approach to this.
Yeah, and one more point probably I will mention. If you know inside your community influential clinicians, whom other clinicians trust, may I ask you, because I think that we explained the main details of the project. We clearly said where we are going and what is our plan about next steps when they will be done. These clinicians can post our post and make the call for other clinicians, because there is a trust also between professional communities. Hisham, he's from pharma, I'm from digital health, and we are not clinicians. And this is very important to bring others on board. Thank you.
Thanks. And we try also, I mean, we are still debating which tool we'll be using, because as we go, and Anna, you're so right, we'll need to organize communities by countries and even by location. And we are setting up these communities. So then if you are based in Germany, you talk to the people that are based in Germany to help German people in need. Obviously, we cannot do it on Facebook. WhatsApp, it's a no-go. We are looking at two options. And as soon as we clarify what is the best channel to use, we will share that with all of you.
Thanks. I think that will be, I already started during the conversation to leverage some network, but I think it would be really useful if we would have a channel. But we will be in touch. I'm already thinking.
Yeah, I'm building a secure channel, and it's a private, so then it's GDPR compliant, and yeah, I will share that with you.
Thank you. Okay.
Wish list for support. Okay, that's good. Thank you, Ahuti. You're so nice. She prepared the wish list. Very good. And this is just a grassroots. I mean, we start something, but I'm sure there are many things to do, and feel free to do it. And let us know how we can unify our effort. That's what we did with Nick Gammon, for instance. He's a professor of public health. He started something on his side and said, let's unify our effort. And hopefully this grassroots movement will have a impact not only for Ukrainian people, but beyond afterward.
Thank you. Thank you so much for your time.
Thank you.
Thank you, everyone.
Thank you.
Thank you.
so much.
Bye.
Thank you. Bye-bye.
Bye-bye.
Thank you. Bye.
Thank you. Bye.
Bye.